Now, sometime in the 1990s, an autoimmune hepatitis working group came up with a criteria for the diagnosis of autoimmune hepatitis. And it was a fairly complex system designed originally to identify patients if there were going to be controlled clinical trials. So everyone knew what everyone was talking about. And it never really caught on much. In 2008, simplified criteria were developed and published in Hepatology. Frankly, I don't find it particularly helpful, but if someone wants to look at this, there may be some value in it, but if you're a clinician and you're seeing patients with autoimmune hepatitis, you can understand the absence of viral hepatitis gives you 2 points. Histology that is typical gives you 2 points. Any of these gives you 1 or 2 points. You're already very close to definite autoimmune hepatitis. I don't use it. I don't know who uses it among hepatologists, but it's out there. So let me raise another interesting question. Is liver biopsy always necessary? Well, it had been during the course of my career. Every patient I ever saw with autoimmune hepatitis had a liver biopsy. You couldn't treat them without it. Well, there's now beginning to be a lot of evidence that it may not be essential. If the clinical picture is perfect, the serologic picture is perfect, do you really need a biopsy? Now, if the serologies are negative, this is cryptogenic autoimmune hepatitis, I need a biopsy. And if it's one of the overlap syndromes, or you suspect an overlap syndrome, then clearly liver biopsy is necessary. Why not go through the differential diagnosis? It's virtually every liver disease you can think of for autoimmune hepatitis. And we rule these out by serologic tests. And sometimes, if necessary, if there's a strong history, for example, I drink 2 glasses of red wine every day. I had my first this morning. My doctor, my internist here, he may say I have 2, thinks I had 6. So he may think my elevated ALT, which I attribute to the Crestor I'm on, he may think I'm an alcoholic. So if he suspects I have autoimmune hepatitis, he may want me to have a liver biopsy. I don't want one. Thank you very much.